Welcome to the webinar titled Toolkit for Planning Virtual Cancer Prevention Events. Your host today is Medical Record Associates, MRA, a leading provider of cancer registry, medical coding, auditing, and compliance services since 1986. My name is Michele Webb. I will be your speaker today, and I have no affiliations or competing interests to disclose. This webinar is approved by the National Cancer Registrars Association for 1.0 hours of continuing medical education credit. If you haven't already done so, I would encourage you to sign up for the MRA blog updates and to register for this educational series and future webinars as they become available to you. So our learning objectives for today are to define and discuss the scope of cancer prevention according to standard setting agencies, to identify essential components used to plan population-specific cancer prevention events and programs, and to list the COC required elements for compliance, including virtual events, and to describe the challenges and benefits of offering events on-site, virtually, or in combination or a hybrid combination. So what is cancer prevention? According to the NCI, it's just an action that is taken to decrease the chance of getting a disease or a condition. There are many different types of cancer prevention that your facility can offer. Here's a list of just some. I've listed the risk factor or the topic on the left, followed by the event type on the right. And the event types here are those that matched up according to the NCI. So alcohol consumption, if that's your risk factor, if you want to encourage women to limit their consumption and reduce the risk of breast cancer, the event type would be alcohol prevention. Our topic today really needs to go back and include the pandemic because that is driving a lot of what each of us are dealing with in our facilities today. And when the pandemic hit us in March of 2020 and forward, we saw prevention and screening events were paused. Simply wasn't possible to take them out to the public. And as a result of that, and the result of all the media and the information surrounding COVID, public trust of healthcare has declined since that time. Our oncology services were limited in order to prevent the spread of the virus. Provider services and hospital beds have been reallocated, and we began to see a delay in cancer diagnoses and treatment start for patients who did not want to come in person to the facility. We also saw a spike in telehealth visits during that time. So that takes us to 2022 and what we have today, where there's now a push to resume prevention and screening events, even though public trust is still low. We are slowly starting to see an increase, but it still is low. Our oncology services may still have limitations. Depending on your area, the tier, the infection rates, there may still be COVID protocols in place. Provider services today are slowly starting to normalize. The need for hospital beds has been a little bit up and down, but hopefully is reducing in your facility. And we are starting to see, to some degree, patients who are presenting with late stage or advanced disease as a result of a delayed diagnosis or treatment start. So what does that mean for us today? I mean, we really are navigating a new normal. We don't have a guidebook. We don't have a picture for what this is all going to look like. We're charting some new territory for all of us, but we just know a new normal will probably mean taking into account the pandemic for this year and maybe several or many years to come. But what I want to do today is talk about virtual events and cancer prevention that you can do as a result of this pandemic. So let's start with the primary objectives of prevention. The first one is to target healthy people in specific populations who do not have any symptoms. These are the people that are still functioning as normal in their daily life or as normal as one can be. They feel good. They may be perfectly healthy people. They may have another chronic disease or condition that is known about, but they're managing it well. They feel good. With prevention, you want to motivate these individuals to take some sort of immediate action to lower the risk of getting a cancer. And we do this by encouraging them to take advantage of screening programs designed to detect cancer at its earliest stage. Standards 8.2 for the Commission on Cancer, Cancer Prevention Standard says that the Cancer Committee holds at least one event each year focused on decreasing the number of diagnoses of cancer, and that the events focus on at least one or two intended results. And these are a change in behavior that reduces the risk a cancer will develop, and or an increase in the participants' knowledge and awareness of the cancer risk. As with all things in accredited programs and any event that is planned well, there needs to be supporting documentation. And I would encourage you to err on the side of more or even copious amounts of documentation as compared to being too lean. No one will ever fault you if you have too much documentation, and when you get to the point where you're preparing a final report, you can always choose to omit any documentation that doesn't support the final need. But either way, the COC does require a written summary that is presented to Cancer Committee, and at a minimum, it should include what the cancer site was that you focused on, the target audience or population, information about the venue, the date, the location, the format or the media that was used, the guidelines, the evidence-based guidelines that were used for planning, the type of prevention event, the behavior or risks that were addressed, what were the materials that were used or handed out to the participants, flyers, agendas, handouts, surveys, feedback forms, the speakers and the host, what were their qualifications, what are their bios, the content outlines, or the PowerPoint point slide decks. And then partnering organizations. You're not required to have a partnering organization, although it is recommended, and we'll go over some of those reasons in a few minutes. Now, there's a lot of discussion around the water cooler, so to speak, about what a compliant or a non-compliant event might look like. So I've given you some examples here, and I'm not going to go through everything on this list, but let's just focus on a couple highlights. A compliant prevention event includes an event or meeting that is on-site or in person or virtual, as long as it includes all the required elements, or it can be a hybrid combination of in-person and virtual. There's been some misinformation that virtual events are not compliant, and that is not true. They may be. The event needs to be conducted outside normal or routine business. So, for example, if your primary care provider is already doing colonoscopies or colon fit testing as part of the routine business, then you would need to conduct another prevention event of some sort of nature. Prevention. The other is you cannot include prevention that is given for, say, chemo education or new patient education. It needs to be something that you would not be doing otherwise. In a compliant event, the content is focused on cancer prevention topics, behavior or lifestyle risk reduction, or changes in healthy people with no symptoms. In a virtual event, you must document live interaction with the participants, and that really is the single most distinguishing factor for a virtual event. So, documentation of live interaction. Events without live interaction or a pre-recorded audio, those kinds of things would not be compliant with the standard. So there are a couple challenges that you need to address, and I've kind of have divided these out by internal and external. But let's start with the first one. Internally, the challenge is how will you provide strong, compelling evidence that the proposed intervention or change is beneficial? And we know that motivating healthy people to change is difficult, probably even more so in a virtual environment because you don't have the benefit of seeing their reaction, of making eye contact with them, or soliciting their direct feedback. So, how are you going to motivate that individual? And will the evidence you present be so clear, so concise, that they're going to want to take immediate action? Does the proposed intervention or lifestyle change assure them that they're going to receive more benefit than harm? No one certainly wants to do something if it's not needed or if there's not some sort of appreciable value at the end. So when we look at that externally as part of your content, how are you going to address the complex evidence-based guidelines? We all know that they're difficult, or the standards even difficult for us to understand, but clinical procedures or interventions, how are you going to present that in layperson language? When I was working on clinical trials, our goal in informed consents was to uh, write the content into a sixth or eighth grade reading level. And when you're discussing complex procedures or issues, this is really challenging. And yet, that is the average reading level of our communities and our target audience. And then it needs to be relevant to them. There's no point in discussing a complex a screening procedure or changing a behavior if the community doesn't understand the basics and the basic concept before that. Is the information you're going to present in a practical, logical manner? Is it in their best interest? Is it actionable? So, how are you going to earn their trust? And are the speakers engaging and personable? We all have sat through events where we pressed the snooze button, or you kept looking at your clock hoping that it would end soon. But I would suggest when you're selecting speakers, know how they present, know how they work with their audience, and watch the audience's body language. That is going to tell you volumes about your speaker and how the audience is going to receive the information they share. So this takes us to the next part of our presentation where we talk about your plan. You know, your plan is a roadmap. It just shows the final destination and the best way that you're going to get there. It also eliminates any confusion, it's transparency, and it's the guide that your entire team can follow so that you all follow the same plan, you follow the same procedures, and you all arrive at the destination together. For our presentation today, I've created a 10-step program to a successful prevention event. These steps are: 1, create your plan; 2, identify the population and the objective; 3, build the team; 4, involve your community partners; 5, define the logistics. 6, develop a communication plan. 7, create your content. 8, conduct the event. And then this is followed by step 9, post-event activities. And final step 10, evaluate, document, and present to cancer committee. So let's dive into these in more detail. Your planning checklist. So use a checklist or a planning tool. You can create whatever works well for you. It could be in Excel or Google Sheets. It can be in Microsoft Word or a Google Word document. Anything that is going to be easy to use and relevant to how your team and your organization functions. Design and share the checklist with the cancer committee for approval of the event at the beginning, and then you can use it for status updates and your final written summary at the end. Your pre-event core elements need to include the items here. This is what the cancer committee should be approving prior to the event: the primary site, target audience, behavior risk, the event type, guidelines, proposed topics and speakers, venue logistics, who the planning team is, and other items as necessary. These elements you should have at the time of cancer committee approval, although you may still need to finalize some as you move along. So step number 2, identify the population and the objectives. Describe the target population, and you want to be specific here. So it's not just enough to say that you're going to invite the community to your prevention event. You want to know who in the community, their gender, their age range, their ethnicity. It may be limited to your marketing demographic or catchment area. Be as specific as you can so that you can use this further down the road when you're defining your content. And then again, what's the primary focus or topics? You don't want to just say breast cancer prevention. Are you targeting alcohol consumption? Are you targeting genetic risk? Are you targeting smoking? These kinds of things. You really want to narrow the field, and then that will help you also as you do your content development. Once you know your focus or your topics, identify the unhealthy behaviors or risks that you observe in your target population. So you can use your community needs assessment, site-specific documents, or even your local or state cancer control plans. County may have something, so that you know exactly what your target audience needs. Don't make assumptions here. You want to provide the audience with what they need so that it is relevant to them. When you have this information in hand, then you can develop those 3 to 5 learning objectives based on those behaviors or changes, what the target population needs, and then you can begin to identify how they're going to take action. So I hope by now, already in step 2, you're seeing how these steps are designed and they start building on one another. In step number 3, you're going to build the team. By now, you probably already have a lead or a moderator, but this person should be charged with making sure the requirements are met. They should be reporting out to the cancer committee and helping the team to stay focused, motivated, and on time. Include your speakers. Know who they are by name, title, their credentials, qualifications, areas of expertise. For your marketing plan that we're going to talk about later, you want to start gathering their CVs, their bios, or headshot photos or graphics if they are available. Include on the support team your content or subject matter experts. So for example, if you're presenting a topic on healthy lifestyle and nutrition, Make sure that your oncology dietitian is on board. And depending on the subject matter, you may have more than one subject matter expert. You may want to include your nurse navigators, your case management people, whatever is relevant to the content and the learning objectives you will be developing. Include someone from your marketing or communications department. These individuals can help you with promotions. They may have ways to contact people. You may include someone from your foundation. They may have access to inviting community members that you wouldn't have otherwise. Don't forget your logistics. Include the people that are going to help you with the meet and greet, the Q&A, concierge registration. For example, several years ago, I helped with an event. I was to help register people. I was not included in the planning process. I was simply told to show up. And when I got there, the table wasn't ready. We didn't know how we were registering the people. It was very chaotic. And unfortunately, our audience, our invited guests, picked up on that. And so there was a lot of dissatisfaction because we appeared to be disorganized. Had we all been included in the planning event, I'm sure that event would have gone a lot smoother. So you don't want that kind of outcome. It's embarrassing and it's quite uncomfortable. Also include someone on the technical side. Since you're going to be looking at a virtual meeting, make sure that you've got the right person from your IT support team or a technical support person that can guide you through what those requirements will be. And step number 4, we're going to talk about involving your community partners. So there are several things to look at, and one is how you select your partners. Are there any conflicts of interest or barriers that might exist? Any associated costs? And then looking at limitations or acceptable control factors. So when you're selecting them, what population do they have access to? They may have a broader scope than you have. What value do they bring to the event? Will they be able to promote or market the event? And do they have meeting facilities or a venue that can be used? With COVID protocols still in place, a community partner may have a larger venue that you can invite more people to while still meeting your county specific infection control parameters. Look at this information as you begin identifying your partners and before you bring them into the team. And that way you can pick the right partner for the project and for the event you are planning. Address any conflicts of interest or barriers. Are your partners' businesses congruent with your facility's business mission or value? Look at whether there are any concerns regarding Stark laws or other regulations. Your marketing or communications person can probably help you with that. Also identify any costs, tangible or intangible costs. If your community partner is expecting compensation for their contributions or for their time, for use of their venue, you want to identify all of that ahead of time. You need to make sure that you have budget and leadership support of what those costs might be. It also eliminates any embarrassing misunderstandings or post-event issues that you might need to resolve. Look at other limitations. Branding is a big one. So if you're going to brand the event, whose logo is going to be the most prominent? Or if you're going to involve community partners, where is their logo? How are they going to be representative? Everybody's going to have an investment or stake in the event. So you need to address those ahead of time. Again, be transparent, make sure that everyone's on board. Look at their practice or business reputation. If they have a shady business or if it's perceived as having an unethical practice, or if there's, let's say you're looking at a community clinic and their patient population is not happy with that medical group, then you may want to reconsider partnering with them. Another good one is referrals. It's great to bring in community partners or some of our providers, but you want to make sure that they're actually referring patients to your facility and not to your competition down the street. Are your partners in congruence with the evidence-based guidelines that you're using? For example, if you are looking at the schedule for mammograms, and your partner is using United States Task Force and you are using American Cancer Society or NCCN guidelines, then you're not going to be congruent with one another. So identify that all up front. Once you kind of have a profile, as you've seen here on your partner, then you're going to know the right partner to bring in and involve in your event. Step number 5, logistics. And this is an interesting one. On several occasions, I've seen where a date was picked on the calendar and a time that met with the speaker's preferences, but it really wasn't the best time of the day or time for your audience. So you want to make sure your logistics are targeted to be convenient and attractive and comfortable for your target audience. What's the best day of the week? Probably not on a Friday afternoon before a holiday, or maybe it is. It just kind of depends. But what's the ideal time? You don't want to be doing a meeting at 9 o'clock in the morning or 8 o'clock in the morning to young mothers who need to get their children off to school and pack lunches and so forth, or at 4 o'clock in the afternoon when they're trying to get little Johnny off to soccer practice, those kinds of things. So consider all the date and the time in advance and target it to the right group. Is there adequate time to prepare? If you're just pulling out your planning checklist today for an event that's going to happen next week, you may not have enough time to prepare. And then the availability, and I've seen this one happen several times. It's kind of interesting, but as you pick dates and times, check first with your speakers. Make sure that they are going to be available, that the venue is available. Don't commit and then find out after the fact that you need to change the date again. Then let's look at your venue. Today we're talking mostly about virtual or hybrid, so I'm going to focus on that for here. But if you are looking at virtual or hybrid, what's your platform? Are you going to use Zoom, Skype, Google, Microsoft Teams, Facebook Live, all of that? Your organization may have a requirement or a preference, but that technology could include or limit the audience participation. Make sure that your platform allows for event recording. You want to record the event. Is it capable of capturing live interaction? And this is a key. We just identified previously that live interaction is an actual requirement. So you must make sure that that exists. How are you going to capture attendance? And then what's the accessibility of the average attendee or those that are technically challenged? If the platform requires that your attendee get registered and then they have to go through a firewall and go through email or multifactorial authentication, then you're going to be limited as to who can attend, and it's just going to increase their frustration and ultimately not present your organization in the best light. Establish a mechanism to print or capture virtual chat or interaction. And I'm going to say this several times because it is so important. And I have seen events where everyone assumed that this was possible, but it wasn't planned for ahead of time. And this one element can make the difference of a compliant event or not. So then look at the schedule of events. Is it logical? Is it reasonable? Do people have adequate time? And will it be attractive to the target audience? If you're going to present an important topic and you're limiting it to 3 minutes, and the audience at the 6th and 8th grade reading level needs more time, then 3 minutes could be a problem for them. Or is it going to go too long? Um, so those are the things that you need to look at. You need to be very honest, and again, encourage transparency. Okay, so let's look at step number 6. Now, here's another step that a lot of people skip, and just assume or delegate to someone else to do. And I would encourage you that while this is in and of itself is not a COC requirement, based on my experience and what I have seen in looking at successful programs, they've always included a communication plan. Look at your flyers, your invitations, your announcements, your registration. What are the data elements that you're going to require for minimum registration? You want as many elements as you can, but you don't want to be too intrusive, and you also do not want it to take too long to produce. So, for example, if you asked a registrant for their name, their date of birth, their age, their street address, their zip code, their telephone number, their email address, you likely are not going to get all of that. So know what those core elements are. Now, at the same token, these data elements can be used to help you evaluate outcomes post-event. So you need to spend some time deciding what it is that has the value for you. And then for your registration, what's the process? Is it going to be manual, paper, fax, phone in? Is it going to be done electronically from the website or from an email link or a combination thereof? Again, target that process to your audience and what they are most capable of doing and completing for you. In your communication plan, describe. And when I say describe, I do not mean in a lot of text or content. It does not have to be a book on, war and peace, but it does need to be complete enough that everyone on the team understands. So, how are you going to communicate internally and with your audience before, during, and after the registration process, and by whom, before and during the live event, and then post event? Finally, in step 7, you're ready to create your content. And a story is told about Steve Jobs. Steve Jobs was very focused and very cognizant of how his presentations impacted um, product sales at Apple and how people perceived his products. He would literally begin planning all of his presentations or product launches 4 to 6 months in advance. And the story is told that he liked to use post-it notes and that he would place these post-it notes on the glass wall in his office so that everybody in the office suite could see what he was doing. He would do them by content or by point. He would move the post-it notes around, but he would spend a copious amount of time preparing the content, but only after he knew who his audience was and what he was talking about. So I would encourage you, a lot of people dive right into creating content first. It's the fun part. Certainly understand that, but resist the urge. Create the plan, follow the plan, do all of these steps prior to that. Then create your content outline. Know what that content is, and then you can create a beautiful visual presentation based on that content. And your content, your PowerPoint should not be a word by word verbatim representation of what you're presenting. Certainly for the community, you're going to want to use graphics and pictures, anything that that person can identify with. I know in this presentation today, using a little more text than I normally like to, but in this presentation, I wanted to give you all the details to take away from home. But if I were to give a presentation to the general public, one that has all the text like we have in this one today, probably would not be that effective. So once you know your content, then you can start preparing the handouts or the educational materials based on that final content. You certainly can't prepare a handout before you know what you're going to be speaking on. So your content should also support what's written in evidence-based guidelines. You don't want to hand out a handout that says that you should get a screening mammogram every year when your screening guidelines say it's every 3 years. And I'm just using that as a reference. But make sure all of your material is congruent with one another. Consider creating a Q&A handout after the meeting that you can send to all participants. This can be branded. It can be a great marketing piece. It also invites one-on-one dialogue or questions that your audience can give to you after the meeting and opens the door for them to become a patient at your facility. In your handouts or your resources, identify any local organizations, clubs, or services that can provide additional information that may be support groups. And then where can they find them? Or there may be additional educational materials on your facility's website or say on a SEER website or NCI website that they can take advantage of. All of that should be part of your content plan. Finally, you're going to be ready to conduct the event. And I've divided this into 3 phases: the pre-event, the event day, and the post-event. The timing of these may vary for your organization, but prior to the event, I would, at least a day or two before, I would test the controls. Get your presentation team together, test the controls, the online virtual controls for speakers in the virtual meeting platform. Do they know how to log in? Do they know how to share the screen? Those types of things. The last thing you want to do is prepare an event where they don't know what they're doing because they could potentially cut off your audience or delay the meeting. And it just doesn't look good if you don't know how to use your technology. Practice with your team entering, printing, capturing that live interaction, the chat box, the screen share, the Q&A. And again, I point this out because this is a critical part of compliance for virtual events. Review the process that the team is going to take to resolve expected or even unexpected problems. You have the right people at the event and in the background that can help you find someone, make phone calls, send emails. One event we had an administrative assistant sitting in the room, but behind a wall so that we couldn't see her. But she was there and available and had access to all the speakers and to the facility resources behind the scenes. Pre-event, review the event day schedule, registration list, or any last minute logistics that need to be talked about. Then on the big day of the event, make sure your speakers are logged in 20 to 30 minutes prior to the event. Conduct a very quick technical test with each of them: sound, screen share, tap box. You never know. There are constant updates being pushed out. You want to make sure that everyone's software and technology is ready to go. The other thing is while you're conducting those technical tests, be mindful of what you say because you don't know who else is logged in your meeting and what you may hear. I remember logging into a national webinar a couple months ago where there was discussion in the background about whether a certain person at a certain hospital was going to be present or not. It was very uncomfortable. So just be mindful of what you are saying and to whom. Open up the meeting for remote access by your audience at least 15 to 20 minutes prior to start, maybe even 30 minutes. Display a welcome and we'll get started soon message. You may want to play some sort of appropriate music. And by appropriate, I don't mean AC/DC or hard rock. Probably more along the lines of elevator music. But do something so as the participant joins, they know that they have entered the right meeting room and what the plan is for getting started. Be prepared to have some sort of process in place to handle people who are having trouble with access and getting in. So you may need to have someone that's moderating or watching that live chat box the moment you open the meeting up. Post-event, and we're going to talk more about that in the next slide, but post-event, you want to make sure that you gather all the required documentation. This should all be outlined and detailed on your planning checklist. So step 9 is those post-event activities. And here's what I would recommend. While you can end the meeting and you can turn off recording, I don't recommend that you close the virtual meeting room until you know you have all the documentation and the records you need. Once you log out of that meeting room, you can't go back. So again, because this is a critical requirement for the COC, you need to have that checklist. You need to have people assigned for gathering that required documentation. Identify any of the expected or unexpected technical problems that you encountered and how they were resolved. This can just be a quick email or note update, but you're going to want to use that information in the next steps. So what were they? Who had them? Was an audience, an internal member, whatever. Launch your post-meeting communication plan with your participants. That may be including how you send out CE credits. You may be sending out the Q&A handout. You may be sending them a list of contacts or where they can go next or resources, whatever it is. But launch the post-meeting communication plan right away. The sooner you reach out to those individuals, the more likely they are to take action and to respond to your facility. The other thing that I don't believe that we do often enough is to send thank you notes or emails to your speakers, to your internal team, to the providers, your leadership, but also send thank yous to your attendees and participants. Thank them for their time. It's a lot like when we get on an airplane today and they say, we know that you had a lot of options. Our community people have a lot of options these days. Thank them for their time. And then send out any giveaways or handouts you may have. We've now arrived at the last step. Step number 10 is evaluate and document. This is where you pull everything together. That planning checklist or tool that you've been creating from day one is going to be rich with data and robust and have all sorts of information, but now you need to pull it together. Get together with your planning team one more time, kind of do a self-assessment, be as objective as you can, but talk to them, ask them to be brutally honest with what was successful or what was not, what the participant feedback was, Read that, review that with an open mind, and then from that, describe the lessons that were learned, good or bad. You have nothing to gain by not being totally honest here. Put all of your notes and findings into a written form back on that planning checklist. Include any relevant notes, findings, or handouts, and then pull your written final summary together that you're going to present to Cancer Committee, the BPL, and I would suggest even to your oncology or facility leadership. Talk about what worked and didn't work. Talk about what those outcomes were and how you have impacted the community, because that's what we're here for, right? The point is to be patient centric, to be community centric, and to make a difference in people's lives. We want to tell the story that will help them go out and take some sort of action that will make their life better and reduce the incidence of cancer. Use these notes, save them, file them, keep them. And then next year, when the event comes up again, when you need to do another planning event, pull this out. Look at what your assessment was. Build a culture and an environment of continual learning and growth and building on what you've done so that each successive event is better than the last one. So, in summary, all cancer prevention events, including virtual meetings, may be COC compliant if they're planned well, if the team members participate, if you have identified the population, the behavior, and the risks, if you can logistically support the goals and the requirements as defined by the COC, the NAPBC, or any other standard setting agency, or those that are set by your team, if the communication and marketing plan is frequent and clear, if the community partners are involved and they add value to your event. And lastly, and we know some people say the devil is in the details, but certainly your documentation and what you present to Cancer Committee, what you share with the COC at site survey, this is a critical piece to compliance and success. Make sure that it's gathered and complete with all the required elements. For virtual events, include documentation of live interaction. Know who the participants were. Know how many registered, how many attended. Be able to summarize the outcomes of who your audience was and how that relates to your statement of your target population. Document it all in the final written summary. Present it to Cancer Committee, note the discussion in the minutes, and of course, save that documentation for your site survey. You've put so much time and effort into this. By the time you get to this point, you should have had a successful event. Make sure you save it and that you use that information in the future. So in closing, I hope that this event has helped you. Hope I've given you some pointers that you can use for successful events in the future. If you have any further questions, please post those. MRA will give you some instructions on how to do that, and I hope to see you in future events. Thank you so much for participating today.